Hi, my name is Mark. I'd like to talk to you about the four indications for mechanical ventilation. The first indication I would like to discuss with you is acute ventilatory failure. And in acute ventilatory failure, usually the patient would be exhibiting some form of bradypnea or in some severe cases, apnea. And in acute ventilatory failure, we like to focus on the patient's ABG. And usually there are two figures that we actually look and pay closely attention to on their ABG, and that would be the decrease in their pH and the elevation of their PaCO2. The second indicator is actually impending ventilatory failure. With impending ventilatory failure, just like the first indication, we focus on the decrease in their pH and the elevation of their PaCO2. Of course, another name for impending ventilatory failure would be progressive respiratory acidosis or progressive hypoventilation. The third indicator for mechanical ventilation would be severe hypoxemia. In severe hypoxemia, usually is defined under ABGs to be a PaO2 of below 40. But it's a little bit more complicated than that. Usually, we not only look at how low their PaO2 is if it falls below 40, but we also like to look at the patient's saturation levels if they're satting below 75. But not only that, we also have to keep in mind if the patient may have refractory hypoxemia, which can be an indication of not only a VQ mismatch, but also could be an indicator for a true shunt. And in that case, we definitely want to put a patient on mechanical ventilation because we would like to actually treat it with PEEP at that point. The fourth indication of mechanical ventilation is prophylactic ventilatory support. Usually that's given to a post-op patient or post-operative patient when they're going through post-anesthesia recovery. Another reason to give prophylactic ventilatory support would be if the patient is exhibiting some form of neurological muscular disease, such as Guillain-Barré syndrome or myasthenia gravis. And of course, the third reason why you would give prophylactic ventilatory support would be if the patient is showing some form of muscle fatigue. It's usually found in most end-stage COPD patients. Well, that kind of wraps up my video. I hope the video was helpful. Thank you for watching.